Assume nothing. I just finished up a day of taking care of patients today, and I'm going to go over one of the things I learned from 21 years of clinical practice, and I share it in my book, Miracles in Minutes. And then I just assume nothing. What's interesting is human beings, we all enjoy helping each other, and we find something that works for us and assume that it'll work for someone else who has the same thing. I have shoulder problem. This is what I did, and we just want the best for them, so we assume it'll help them. That doesn't always work out so well. It's not because of your good intentions. It's just because we're all unique human beings, and even though they may have similar symptoms, that doesn't mean what's causing their symptoms is the exact same thing. So I cover that concept in my book, Miracles a Minute, Assume Nothing. And I'm going to expound upon it a little bit more, that if just so we understand life, and whether you're a doctor or just a human being in general, and learning how to understand life a little bit better, there's a great book called Who Moved My Cheese? And it's a metaphorical story about four different mice, and they find cheese, and then one day the cheese disappears. And a couple of the mice assume that since they found cheese there yesterday, they're going to find it there again, even though the cheese is disappearing. Then one day the cheese is gone, but they keep doing the same thing, assuming since they found cheese here before, it'll show up again. So where am I going with this? We do certain exercises and we found success. We did something in our life and we found success, and we assume that since that worked before, it will work again. And I hate to say it, but sometimes the life and our brains are so unique that what worked one day may not work the next day. Instead of getting confused and try to make sense of that, the best thing you could do is just to accept the fact that sometimes it works and sometimes it doesn't. Find what's working for you today and do that. So in Miracles in Minutes, I cover the importance of setting a baseline, because the only time we can really help ourselves as a human being is today, in this present moment, right here, right now. We like to talk about what we did yesterday and what we're going to do tomorrow or in the future, but the only time we can actually help ourselves is right here in this moment. So when I examine patients, I ask them what's going on right now, because we're getting ready to take some action steps right now, and we need to find out if what I'm getting ready to do or suggesting for them to do is helping them become better or not. So again, this is all assume nothing. Now, I can even do it to one side of their body, and a lot of times we assume we need to do it both sides. I can tell you clinically, a lot of times it doesn't work out. Some people it does, some people it doesn't. You may do something to one side of the body, a certain stretch on the right arm, and all of a sudden they improve. You do it to the left arm, next thing you know they got worse again. So that's how important it is to have care that's unique to that person, to right here, right now. It does require a lot more time. That's why people don't do it and they hand you an exercise sheet or just have the same care plan for everybody. It's very systematic, it's very fast, but the results, you may not get what you want. So don't assume anything, whether you're a doctor or a patient. Do something. Set a baseline and see if the baseline improves. If it does, great. Do some more. If not, stop. So that's the concept I want to cover today. It's covered in my book, Miracles in Minutes, helping people become pain-free in less than about 2 minutes. Usually it takes about 30 seconds. Thanks a lot. Have a great day.